Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And today, it is my very great pleasure to welcome Miss Alicia Baptiste of St. Lucia. Ms. Baptiste is a registered nurse. She's a registered midwife, a community health nurse, public health nurse supervisor, and a principal nursing officer, recently retired. And she's worked in these positions over a period of 35 years. She describes herself as a phenomenal, accomplished nursing administrator and ambassador for the St. Lucia Nurses Association. She is currently the Region 3 Director of the Caribbean Nurses Organization. In addition to all of this, she has served St. Lucia in many different ways. She has been the General Secretary and later President of the St. Lucia Trade Union, the National Organization of Women. She served as President, CARFA, the Caribbean Association of Feminine Research and Action. She's a member. She's a former board member of the Social Development Fund and a current board member of the Millennial Heights Medical Complex. Along the way, she has acquired many, many, many certifications and honors. So, Ms. Baptiste, welcome, welcome, welcome.
Thank you so much. I am so humbled this morning to be your guest speaker.
Oh, the honor, believe me, the honor is mine. The honor is mine. To get to speak to nurses everywhere is an ambition of mine, and I'm so grateful to be able to do it. So thank you for helping me with that. So the first thing I always want to know from nurses is why? Why are they nurses? Why are you a nurse?
Okay, my mom, rest her soul, and today she would have been 89.
Wow.
Contributed to me wanting to become a nurse. My mom took care of my daughter, and it was during that time she was cooking. Again, we are from the Caribbean, and she was cooking outside on a coal pot. And she fell over a hose, and the water fell on her, and my mom got second-degree burns. And I was there to nurse her back to health. And it was that propelled me into nursing, and I have not regretted since.
Yeah.
And also my love for people.
Yes. That's always a big thing. You really do have to love people. And it's interesting sometimes that, actions, things propel you, as you use the word propel, actually. And sometimes that really is what happens. So you already had a daughter. I mean, so you were already a family person starting a new career. What were the challenges for you?
Oh, well, for me, I have always been challenged from my student days to my leadership days.
Okay.
Because of that, I have always been a very assertive person, and many people misconstrue my assertiveness for being rude. And so most times you are not liked. But these challenges, what it did was just propel me further. And I took the challenges and used them to become better, to make changes, and to reach my goal in nursing.
Yeah. And as I read in your bio, you have served in nursing in so many different capacities, too, and including principal nursing officer, which is quite an achievement. So as I read, and I'm going to digress a little bit because something that I didn't read about in the bio is that you have or had at some point a symbiotic relationship with a health or some part of the health department in Taiwan. How did that come about, and how did that help you in your service in St. Lucia?
Okay, it was the Ministry of Health provided that opportunity for me to go to Taiwan for 6 weeks as an exchange program to learn the culture and what happens in the hospital. And I went to Taiwan in 2019, and I worked at a hospital in Taiwan and went around with the nurses and saw the challenges, also learned quite a bit from them, especially in risk management, in caring for persons, especially during a pandemic. And this really helped me. So coming back to St. Lucia, and we were hit with COVID at the end of 2019 into 2020, really assisted me as the principal nursing officer of a district hospital to better be able to put things in place to better handle the pandemic. And for me, it was very good to see that what we came up with at the Denry Hospital as a team, because I believe in a lot of teamwork, we were able to allay the fears of the workers, because there was a lot of fear. But I never got absenteeism, because again, the nurses and doctors, they felt we worked as a team. We had debriefing sessions. We also had coded papers, so people were all part of it, so they knew where persons had to go. So we were able to even prevent any of the staff from being infected with the COVID. You understand, the COVID at the time.
Yes.
And so, and what was very important is that the leader do not see yourself as being just there on an 8 to 4, but being there with the team throughout. So I worked on both shifts to make sure that I was always there to assist them, made sure that they had the correct PPEs, you understand? So they felt comfortable. So that was my learning from Taiwan, really assisted me with what came about with COVID.
Yeah. And I don't know, I cannot say that no one else can say this, but I don't know anyone else or know of anyone else who can say that none of their staff contracted COVID. So for me, that is like, I don't know, that's way off the charts. That is way off the charts. So having been in all of these areas, and I know that you have, when you started by saying that you're very outspoken and very much, people may misconstrue. So I see you as an activist. And so I know that along the way you must have effected some change. But what would you like to see change, if anything, in St. Lucia? And you're part of the regional Caribbean nursing organization. So in St. Lucia and in the Caribbean in general, what would you like to see change?
Okay, for me, what I would like to see change is for us as nurses to see our value, how resilient we are, and that we are able to sit at the highest level policy and also in government. It is time for us as nurses to see that. Also, we need to move away from that slogan that has been infecting nurses for the longest while, that nurses eat their young. I would love to see that be a thing of the past. We do not need to bully our young nurses. We need to hold their hands, guide them, because we too were student nurses before we became full-fledged nurses. And we have to learn to be more caring and learn to climb the ladder by holding the hands of others.
Yes, I could not have said that better myself. I think not that said that better myself. And just as a quick aside, because this is your day, so I'm not actually bringing anybody else into it. But just so you know, there is a nurse out there who's starting something or has started something called, just because of that, nurses eat their young thing. And she started something called Nurses Feed Their Young. She's talking to nurses to feed rather than eat their young. So
That's
that's
very
an awesome.
interesting. I would love to hook up with her.
I can do that. So, what advice, though, would you give to someone who wants to be a nurse? Because you know what? Becoming a nurse today is very different than becoming a nurse when you and I became nurses. Or I shouldn't even say you and I, because I've been a nurse longer than you, so older than you. So when you became a nurse, though, I do know that becoming a nurse today has different challenges and different outlook than when you became a nurse. What advice would you give them?
Okay, nursing is and continues to be the most noble of professions. But what advice I would give them, that you need to be sure this is what you want to do before you enter nursing, because nursing demands a lot from you, a lot of sacrifices. Okay, so you need to be sure that's what you want to do. Nursing is not about money. If nursing was about money, most of us would not be in nursing.
That's a fact. That's a fact. Most of us would not be in nursing. So there are things, though, that being a nurse requires. What would you say is the most essential quality of a nurse? In your words, if you could do it in one word, what would that word be?
Empathy.
Empathy. Okay.
We need
Empathy
to
is
be
huge.
able to put ourselves in other people's shoes. When this patient or client comes to us, there is what you call fear of the unknown. They are going to react in different ways. It takes you, the nurse, to place yourself in their shoes, to understand the reason for sometimes their madness.
Yeah. Yeah. And to realize that, all of their angst, though you might be in the way and receive the angst, it's not really directed at
It's
you.
not directed at you.
It's not really directed at you. So, getting personal with it is not helpful to the patient at all. It's not helpful. Empathy, big one, big one. And sometimes we need to be a little bit empathetic with ourselves too.
With ourselves too.
So we're talking a lot these days about well, let me go back a little bit, because one of the things that I'm hearing, you're in the Caribbean, here I am in the United States, and in many of the places where I speak to, people are talking about staff shortages and unrealistic expectations. Are you experiencing the same thing?
Very much so. Very much so. Because the bigger countries are very attractive to our Caribbean nurses. So a lot of our nurses are migrating to the bigger countries. And what is happening is that we have a great shortage of nurses, especially experienced nurses in our country, St. Lucia.
Ay, 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 ay.
How do we fight that? How do we
I was
fight
like,
that? We
yes.
cannot, as a small developing country, bid and offer to the nurses what these big countries would. So it is a challenge.
Yeah. I have thought about, as a Caribbean person myself. I have not worked. I did work for a while in the Caribbean, just for a couple of years, but I haven't worked in the Caribbean for quite some time. But in thinking about this and how this could affect, I'm thinking that probably one of our mistakes, I don't want to use the word mistakes, but probably one of the things we're not seeing is that we're trying to offer the same kinds of things that other people are offering. Maybe we need to look at what we can offer that others do not have to offer. It may not be financial, but we may be able to, make something else a little more attractive that
Yes,
others do not have to offer.
Yes, and I think maybe there needs to be a lot more research into this.
Mhm.
Um, what questioning some nurses, they will say to you they do not want to leave their country, but upward mobility,
Aha.
training.
Mhm.
No nurse wants to stay at a level for 6, 7 years. What
Exactly.
are we offering for them? So I think it is time for governments to invest in their nurses.
Mhm.
So provide training opportunities where you pay for them and you bond them. So they give service for a number of years before they can leave.
Yes.
So
Yes.
these are areas that governments need to look in, but they need to spend some money in investing in our nurses,
Yeah. Yeah.
especially in the Caribbean.
Yeah, 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 and you see, this comes full circle to what you were talking about earlier about having nurses in government areas, having nurses make policy, because this is how you're going to get stuff done as far as attrition and all of this migration and stuff that affects your nursing population. This is how you're going to get stuff done.
You're so right, Dale. For example, having a nurse as your minister of health, you
Exactly,
expect this nurse to understand what the health sector needs with in relation to nursing. And
exactly.
so there is better opportunities for this to happen than you have just any ordinary civilian out there as your minister of health.
Yeah, 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 and that is what happens a lot. And we need to, and our nurses need to feel empowered to put themselves in these positions, in these positions. So one of the things that I frequently ask nurses also comes out of, this talk of burnout and stuff like that. And so I ask nurses about self-care and what self-care means to them. Because we as nurses tend to put ourselves way, way back on the back burner. In fact, often we're not even on the stove. Um, so what does self-care mean to you?
Self-care means to me to ensure that my holistic well-being is taken care of.
That's a big statement. You want to tell me what that means?
See, if we look at what is health, health encompasses so many things: your
Yeah,
social, your spiritual well-being. So as an individual, you need to ensure that you take care of yourself holistically. Your physical, your spiritual,
yeah,
your social, and a lot of us nurses tend not to have a social life.
yeah. I know.
All we do is work and be at home. We need to
Hmm.
have a social life, go
Hmm.
out, and spend time with others. We
Yeah,
need to do that. And that's what I mean to ensure my holistic well being.
yeah, yeah,
And
yeah,
also to take the advice that I give to my clients daily. We advise our clients, but yet, still, as nurses, we do not do these very things.
that's a huge point right there. That's a huge point because, yes, we accept things for ourselves that we would not accept for our patients. Yes, absolutely. That's a huge thing right there. Remember that you're a person too. You're a person too.
Yeah,
Yeah.
definitely.
Yeah. I spoke to a nurse the other day who pointed out something that I thought was very profound because very often we talk about filling up our cup, and pouring from a full cup. And she said, I do not pour from my cup at all. I pour from the overflow. Aha, of course you do. And maybe we should learn to do that. Maybe we should learn to do that because if you're pouring from your cup, you're constantly trying to fill
You
up that cup.
constantly to fill your cup. Yes, so it has to be from your overflow.
Has to be from your overflow. It has to be from your overflow. So, what would you say? And I know that you, looking at you and reading about you and your achievements, I know that you have many things on your table that you want to do. But what would you say is your greatest achievement so far?
My greatest achievement. I think my greatest achievement would be obtaining my bachelor's in public health, because this is my passion, and also being able to impact my country in that field. Another one would be being the principal nursing officer of a district hospital, because what I was able to do was to bring a fragmented team together, because I believe in teamwork. And
Mhm.
at the end of me retiring, I saw that team come together, and I saw the teamwork, and I saw the effects of that teamwork. And so for me, these are my greatest achievements in nursing.
Wow, you just gave me goosebumps because so often we set out to do something and we may make progress, but sometimes we don't actually see come to fruition and work. So that's huge. That's huge. And I pretty often ask people about their greatest achievement, not so much because I necessarily want them to brag, but because I believe that when we achieve things, um, every now and then it helps us to look at what we've achieved and see where we have come and where we want to go. But often we as nurses get so lost in the work that we don't remember that. And we
Yes,
don't
very much
remember that.
so.
And I'm so proud of you looking at behind you. I'm so proud of all those accolades and the
Awards.
awards. Yes, where are the awards behind you?
Yes,
Yes,
yes, and
yes, let it
I'm
show.
very humbled by it. Um, One of the things also I could say that I'm proud of is being the president of the longest serving president of the St. Lucia Nurses Association. I worked hard at fighting for our nurses to be recognized. Um, and I am thankful for that. And one of the things before I left that office was to have a memorandum of understanding signed with the Taiwan Nurses Association. And we get quite a bit from Taiwan to assist us in, networking, attend
Yeah,
conferences. So for me too, that was another great achievement. Um, nurse, Being a president of a nurses association places you in so many different um, difficult situations, sometimes being, disliked by governments.
yeah,
But, at the end of the day, you are a nurse and you want to see what's best for nurses. And sometimes it takes you to go down that road of not being liked. And I am thankful for that opportunity to
yeah.
now be able to say I have been the longest serving president of the St. Lucia Nurses Association.
Congratulations on that. Congratulations on that. So before we go, is there any little gem, any little nugget that you'd like to leave us with?
Okay, I would like to again call on our nurses to realize our power. We are a very powerful force, but this can only happen if we come together. We
Yes.
cannot be seen as a fragmented group. We
Mhm.
must come together, and the power that we have will be able to be seen by everybody, including governments. We will be able to move this world in ways that we cannot even imagine, because too many of our government officials knows we are fragmented. We need to stop this and be able to be respected for the resilient set of people that we are.
Wow. 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 There's nothing I can say to top that. Thank you so very much for this conversation. I truly, truly, truly appreciate it. Thank you.
Thank you, Dale. Thank you for such an opportunity. Thank you so much. We have just built a friendship.
Thank you. Yes, indeed we have. Indeed we have.